We're going to continue our video series on recurrent pregnancy loss, and today we're going to talk a bit about sort of hormonal causes of pregnancy loss. I mean, when we talk about hormones, there are a whole range of hormones that are involved in pregnancy, but when we talk about recurrent pregnancy loss, there are three main groups of hormones. One are sort of the hormones involved in polycystic ovarian syndrome, thyroid hormone, and progesterone. So they're the big three. If we go through each of them, PCOS involves essentially a misfiring of hormonal signaling, where instead of having a smooth communication between different organs in the body, different hormone producing organs don't really talk to each other. So there is essentially a hormonal disarray in the reproductive system, leading to the symptoms and signs that we see in PCOS. In terms of pregnancy loss and recurrent pregnancy loss, however, the evidence seems to show that as long as the PCOS symptoms are well controlled, then there doesn't seem to be a negative impact on pregnancy loss and recurrent pregnancy loss itself. So controlling weight, controlling sugars, maintaining ovulation as much as possible, all of these things show this is well managed PCOS, and in this context, having PCOS doesn't really adversely affect the chances of pregnancy loss and recurrent pregnancy loss. Thyroid is a little bit more contentious. The thyroid guidelines change all the time and really depends on which organization you look at, and there are multiple thyroid organizations around the world. What all of these organizations agree on is that overt underactivity or overactivity of thyroid is negative and has a negative impact on recurrent pregnancy loss. So if you have thyroid hormones that show your thyroid is plainly underactive and it's negatively affecting the output of your thyroid, then that needs to be corrected, because that in itself will impact pregnancy loss and increase the chances of recurrent pregnancy loss. When you have something called subclinical hypothyroidism, and that is essentially where the thyroid is still maintaining normal activity, but the body is actually working really hard to get the thyroid to maintain that level of activity. So that's called subclinical hypothyroidism. So the thyroid is probably underactive, but the body is compensating for that underactivity by working the thyroid harder, and therefore clinically we still don't see signs or symptoms of hypothyroidism or lower thyroid activity. In this context, the evidence for it affecting recurrent pregnancy loss is controversial. At the moment, it depends on the level of hypoactivity. So in some people where there's subclinical hypothyroidism, there's subclinical low activity of thyroid is pushing them close to becoming hypothyroid or low thyroid, then these patients probably should have treatment, because we do potentially see a negative effect on recurrent pregnancy loss. But for people who are just hypothyroid, so that is, it's generally okay, the body is starting to work a little bit harder to maintain thyroid function, but it's still not working too hard, then close monitoring of the thyroid hormone is all that's needed. Progesterone, probably the most controversial of all of these hormones. Progesterone is a hormone that is secreted naturally by the body with ovulation. It has an important role in implantation. It has an important role in maintaining the pregnancy, and we know that withdrawal of progesterone is what ends a pregnancy, whether that's miscarriage or actually towards the end of pregnancy at around 40 weeks, progesterone levels drop, so the uterus starts to contract. And the very name progesterone, pro for gesterone, a hormone that promotes pregnancy, indicates the importance of progesterone. There is some data that suggests that in people who keep losing pregnancies, they have an innate inability to either produce enough progesterone at the level of the uterus, or that they are less sensitive to progesterone. What we find is that the more pregnancies are lost, the more likely there is that progesterone may be an issue. And when you look at the trials for progesterone, where people supplement progesterone when they become pregnant in order to prevent pregnancy loss, especially recurrent pregnancy loss, the people who benefit most from progesterone are people who lose 5 or 6 or 7 pregnancies. The people who lose 2 to 3 pregnancies don't tend to have as great a benefit from progesterone supplementation. Progesterone has a whole range of effects. They can go from maintaining a pregnancy to controlling circadian rhythms to modulating the immune system. So the way progesterone works is probably multifunctional and multifactorial. Nevertheless, in people who have recurrent pregnancy loss, on a case-by-case basis, we may want to suggest supplementing with progesterone once pregnant to increase the chances of a live birth. The doses of supplementation are generally quite high, so it's generally about 400 milligrams twice a day through the vagina. And it really should be maintained up to about 12 weeks gestation.